said that we ask, is this unnecessary politics? Is there more than what really meets the eye? Those are some of the questions that we have to look at. Well, as per the doctors, Saif Ali Khan received 6 stab wounds. 2 of the wounds were very severe as well. In fact, there was a knife injury which was just 2 millimeters away from his spine. His surgery lasted 5.5 hours. A 2-inch knife piece was extracted and the actor received 20 stitches. And now his speedy recovery, however, is being questioned by the netizens. In fact, some of them are calling this entire episode as rather suspicious, as was Sanjay Nirupam, instead of applauding his resilience and strength. So, we would like to discuss this evening what's the secret behind Saif's swift recovery. How long does it take to recover from spinal surgery? Did Saif's physical fitness help him recover much faster than any one of us perhaps would have if you are in that kind of a physical fitness? And also, is this an unnecessary political controversy? Is there more than what really meets the eye? These are some of the questions that we are going to be delving into, but we are going to be removing all the political recording. We are going to remove all the speculations which have been put in place. What we are going to do is we are going to go across 2 experts. We are going to go across someone who would know exactly what this kind of a procedure would entail. We are going to be joined by Rachana Tatari, who's joining us. She is a consultant plastic and cosmetic surgeon at the Fortis Hospital in Mulund. We are also joined by Dr. Yavar Shoaib Ali, Associate Director of Neurosurgery in Sarvodaya Hospital. Now, Dr. Yavar Shoaib Ali, I'm going to be coming to you first because as we all know from the details which have been coming out from Leelavati, Saif Ali Khan had 2 different surgeries. One was a neurosurgery which was done by a surgeon, and after that there was a plastic surgery as well. So I'll ask you the question, and it's not my questions, it's actually the question of the Shiv Sena leader. I'm going to ask you verbatim. I want to ask the doctors, he says, can a person whose operation lasted for 6 hours come out in such good shape within 4 days? Dr. Ali.
Yeah, thank you. So, yes, he can. It depends on the operation that has been done. It depends on the, as you mentioned yourself, the physical condition of the person whose operation has been done, and it mainly depends on the extent of the injuries. Now, in case of Mr. Khan, there definitely was this knife piece lodged in his, very close to his spine. There was a little bit of CSF leak as well, as we have been told by his doctors in their statements. However, there was no major injury to his spine. There was no spine fracture. There was no injury to the vasculature, the important blood vessels around the spine. And most importantly, there was no injury to the spinal cord itself. So in keeping in mind all these facts, it's fairly probable that the person should be up and about after the surgery. And it doesn't have any other severe associated injuries also. So should be up and about in 3-4 days. In fact, it's encouraged in modern spine surgery to be up and about in 3-4 days after the operation. And we have to make a distinction here. Just a discharge from the hospital doesn't mean recovery. So the discharge from the hospital means that he is no longer at risk. But it doesn't mean that he has recovered fully. Obviously, there will be a long period of recovery. There will be physiotherapy.
How long is that period, Dr. Yavar Ali? If you can explain it to us, because many are now saying, how is it that he was laughing and jumping when he returned home? This is what, of course, politicians are saying. Let's keep the politics aside. For a person to recover after a surgery where apparently there were 20 stitches which were put on him, and there were 2 of these wounds were said to be very severe. There were stab wounds, and there was a knife injury which was about 2 millimeters away from the spine. You are saying that it is critical, that it didn't hit the spine but was close to the spine, which helped and aided the recovery, Dr. Ali?
Yeah, it was close to the spine but didn't hit the spinal cord itself. So that would have been a very much more major and a major disastrous injury. But thankfully that didn't happen to him. And regarding coming out of the hospital laughing, so it's a lot depends on the person as well, the patient as well. It's patient to patient, things can change.
Absolutely.
So again, to reiterate, the recovery is not like just a discharge from the hospital doesn't mean that the person is recovered. There'll be 4 to 6 weeks of physical therapy. There'll be a lot of things, medications, and then we can talk about full recovery. It's just that he has been discharged from the hospital, so there's no imminent risk now. So that's why he has been discharged from the hospital.
So it's not that he's recovered as is being projected, but it's safe for him to now go home and he can recover at home over the next few months. Now, Dr. Rachana Tatari, I'd like to come to you because you're a plastic surgeon, and as we know, the second surgery which he had to undergo was that of a plastic surgery. Can you throw some light as to what kind of a surgery would have been performed? How long does it roughly take to recover from something like that?
So I think likely to be on a wrist, basically we expect structures like your nerves, the tendons, things like that. So if it's simple cut, obviously it's a very early recovery. But if in case of your important structures being involved, he will need to have, these kind of surgeries are done on a day case basis, in fact, and he will be on to a physical therapy protocol after that, which could be at least from 4 to 6 weeks time. But very routinely, hand traumatic injuries are done on a day case basis very often until there are other factors that need patient admitting on the ward. In fact, I completely agree with Dr. Ali that we're following more and more something called as ERAS protocols, which are like enhanced recovery after surgery protocols, which are followed not only for these the major surgeries, including cancer surgeries. So it's not just the surgery that is important, but also including your anesthesia team, the perioperative care team, nursing, physical therapy. They all are equally important, and these patients are very well put on some multimodal analgesia, like your painkiller medications, your patient control analgesia, even nerve blocks, which help us control the pain well. And the intention behind all this is let that patient recover quicker and faster, and the patient can go home as early as possible, minimizing the complications that might happen if he stays in the hospital for a longer duration. And this is we have evolved a lot in terms of post-operative stay for patients in terms of medical care.
So post-operative care is going to be very, very critical. Dr. Yavar Ali, you had mentioned that as well. Can you give us some kind of a timeline? How long does an operation like this need to recover from fully? Of course, as we know that there was also a 2 millimeter, I beg your pardon, I believe a 2 millimeter bit, or rather a 2-inch knife piece, which was also extracted from somewhere close to his spine as well. That kind of a foreign body which would have gone inside the body, for that part to be taken out, does that also mean that the healing process would be longer to have a piece of knife stuck literally to the back of your back?
So yes, there is a foreign body, obviously. And secondly, whatever we heard from his doctors in their statement, that there was leak of the spinal well. So both these things do predispose to post-operative infections. And one has to be extremely careful with regards to the status of the surgical wound and post-operative infections, because both risk factors are there. There's a foreign body as well, and then there was leak of the cerebrospinal fluid, which I am sure the doctors took care of at the time of surgery. So at least a couple of weeks, very meticulous about the surgical wound and check for any signs of infection. He'll of course need medications, and the whole lot, the surgical, at least 3 to 4 weeks, you can be really sure that no complications have actually taken place.
Okay. So at least 3 to 4 weeks to find out if there were any complications, and after that you have a longer protocol when it comes to physiotherapy. So quite some time is going
on side by side. That has to go on side by side. That has to go on side by side.
That will just continue for a much longer time. Now, Rachana Tatari, it's very important for me to understand this. How important is the state of the patient, not just the physical state, but also the mental state of the patient, come into the entire spectrum when it comes to recovery? How important is it if a person is fit, if a person has been going to a gym every day and is mentally strong?
I think it may be wrong to say just the gym, but I would definitely agree that the pre-surgery state of a patient in terms of your physical health, having no other diseases like for example your diabetes or your hypertension or other comorbid conditions, if you're a non-smoker, and obviously your resilience as well in terms of your pain threshold, do definitely go a long way impacting the overall outcome, in the long-term outcome of these patients. The fitter you are, the earlier you recover. If I mean, if you're not diabetic, then your wounds will heal quicker. There's less chance of infections. So it definitely matters in terms of your general health. Yes.
One quick question now, Dr. Ali. There were 20 stitches which were put on Saif Ali Khan. How long does it take for these stitches to, well, recover from, for these stitches to come out also? And considering they were in some very sensitive areas like his neck, like near his spine.
No, that's okay. But the stitches in different areas, you have different time zones for removing the stitches if the wounds are healthy. So usually in the spine, we like to keep them for around 12 to 14 days. That depends a lot on the wound healing as well. And usually we prefer to keep in the back for 12 to 14 days. And once we are totally sure that the wound is healed, we remove. In the neck, the time period is a little earlier.
Okay.
So it's different for different areas, and it's different in terms of the wound healing in different areas.
All right. Thank you so much, Dr. Rachana Tatari for joining us, as well as Dr. Yavar Shoaib Ali for joining us. Well, we've heard the neurosurgeon as well as the plastic surgeon. They're both saying the raz behind Saif's quick recovery is essentially the nature of the wounds, the physical fitness of the patient, and also the mental strength. And it's not like he's already recovered. As both the doctors have pointed out, he's only been discharged and a long way from full recovery. So I believe there is more of Rajniti than a swift recovery, as it was being called, when it comes to Saif Ali Khan, isn't it? Well, thank you so much, both the doctors as well as all the viewers joining us. For that, a short break. Don't go anywhere.